and now another area for that is because most of the applications that we have these days are no longer on-prem, but they are SaaS applications. I think it's important to just kind of take a look at the SaaS portfolio, the major providers that are out there, and how secure they are. The biggest names, of course, are still Salesforce, ServiceNow, and Workday. They are by far the biggest. Curious, sir, if you have any thoughts, feedback on the SaaS names, how they're working out for you.
Yeah, so we use Salesforce.
Mm-hmm.
Good, very good, actually. I mean, both companies very strong. Very secure, high uptime. Very good. I can only say good.
Yeah, ServiceNow, number one in all of our enterprise applications, incredibly strong, and they're growing as well. It's not just ITSM anymore. I know that they're doing a little bit of infrastructure software. They also will allow you, if you tie it into your HCM or your human capital system, you can basically turn on an employee, turn off an employee, roll out new applications as needed. I'm curious if you're utilizing all of that depth with them, or is it still just sort of a ticketing system for you?
Ticketing only for now.
Yep. Yeah,
but still, we see the possibility. So we're even starting to look at using it for we're starting these concepts around virtual hospitals. So we're looking at using ServiceNow for queuing. There's a chain of hospitals in the U.S. called Mercy Healthcare. You might know them. The one is in St. Louis is a total virtual hospital.
Wow.
They use them, so they have a bunch of doctors on the other end. So whenever anyone does a telehealth request, they create the queuing, and the docs pick up from the ServiceNow queue.
It's very
We're
interesting.
looking at that now currently.
So basically, just taking the concept of a help desk from an IT perspective, but just changing it to the difference between a patient and doctor relationship.
Right, and we did the same. It's like Salesforce, believe it or not. We took the inherent logic in Salesforce and we used it to build cancer registries.
I'm sorry, Ron, I missed that last part. You used it to build
cancer registries.
Oh, wow.
So we use it, and it has the ability, because the Salesforce is based on graph theory, so it has the ability to do precision cancer screening.
That's incredibly interesting. Yeah. So you're taking a typical CRM functionality, but basically saying, okay, instead of my customer, I'm going to use the patients.
Yeah, very, very successful. Actually, we're partnering with Deloitte, and we're actually commercializing it now to market to others.
Is this something you're hearing about other healthcare organizations as well? Salesforce is kind of being implemented in that side. I don't think of it usually in
yes.
that area. Really, that's really interesting.
It's got a big bump in COVID. The logic was used, a lot of places in Canada used it for vaccine scheduling.
Yeah, look at that. When I cut to just healthcare, I would never have expected to see that, but in all of healthcare,
it's growing.
It's growing.
Salesforce is starting to take on. I mean, the inherent, what it can do because of the logic, the way it's designed is amazing. It can do a bunch of different things. Again, most people wouldn't think of it, but they're gaining huge market share in health in different, especially in the development side. People are using it to develop and solve particular niche challenges.
Right.